I basically decided to take this video for you just so that you know what a real presentation is kind of like. It's not going to be exactly like an actual presentation because we don't have an audience, but so normally things that we would do for audience interaction might not go off as well as they will when you're actually presenting. We do have the activities, so we will make note of what you need to do during those activities, and how to set up things, and then how to clean up, I suppose. So yeah, let's get started with the presentation. I'd like to thank you for coming out to our presentation today. We're going to be talking about an eye disease called glaucoma. My name is Karen. I am a biomedical engineering major at the University of Southern California, and I'm a sophomore this year. And the reason I wanted to work with this organization, we're called V4V is because, well, I'm very interested in medicine. I'm thinking about becoming a doctor in the future, and so I thought it'd be a great way to give back while learning about some of the stuff that I'm going to have to know about if I want to be a doctor in the future. So if you have any questions at all, just ask one of us. We're here to help you. So something to warm up, we have optical illusions for you. This one is actually pretty fun. If you look at the middle prong of that fork, right there, you can see that it doesn't actually connect to the actual fork. So this is an impossible object. And this optical illusion, if you look at the horizontal lines, they don't look very horizontal at all. They look like they're curving or they're kind of skewed in a way. But if you take out the blocks, they actually are straight. So that was kind of funny. This one has two images embedded in it. So if you look at the white space, there is a goblet, like you would drink out of. And in the black space, we have two faces coming in. And the next one, we're not actually going to do. So here, we're going to get started with some basic eye anatomy. If this picture of your eye is it's a slice taken horizontally. So if your head would be down here, and you're looking up this way, and the world would be out there. So if you think of your eye as maybe a camera, then you can sort of envision how it works. The cornea is the outer covering. It protects the lens and the rest of the eye. And it's the part that you would touch if you were to put in your contacts, like I do every morning. The pupil is the little black hole in the middle of your eye, and the iris is the colored part around it. And when it gets brighter, the iris the pupil will get smaller so that less light gets in. And then if it gets darker, then it'll get bigger so that more light comes in. You can see better in the dark. The lens focuses the light that comes in onto the retina, which is kind of like the film of a camera. It captures the image, and it sends it to your brain through the optic nerve so that you can see and interpret what you're seeing. So the reason we're here today is to talk to you about glaucoma, which is an eye disease that affects so many people worldwide, and it actually affects your vision from the outside in. And we'll get into more of, I guess, the specifics, which you need to know. But the main reason we're here is because we just want to encourage everyone to get screened for it. Just because the major issue with glaucoma isn't that it's not treatable; it's that it's hard to catch in the very beginning if you don't get screened regularly for it every year. So, how glaucoma actually works. There is a fluid, usually, in your eyes that just helps. It's kind of your eye's version of blood, just because if you had actual blood in your eye, you couldn't see through it. So normally, this this blood of the eye, comes out, is produced in the eye, in this area, and then flows out right here. And drains so that, there's a constant change of the fluid so it doesn't, stop and your eye gets enough oxygen. So in glaucoma, it gets blocked, like right here where it drains, so the fluid can't get out, but it's still being produced, so it starts to build in your eye and then puts pressure on your eye. And the most vulnerable part of the eye is actually the nerve in the very back. And when the eye starts to feel too much pressure, it gives way first in the back. And so vision loss occurs because of damage to the nerve. So we have an activity for you. It's just a little game that sort of will help you understand what field of vision means, because field of vision is what glaucoma really affects. So we have 2 popsicle sticks. Well, we have lots of popsicle sticks, but you'll take 2 and hold them both in front of you, and make sure you keep one of them in front of you and move the other one out to the side until you can't see it anymore. And so right at the edge of where you can and can't see it, while you're still looking straight ahead at the first one, that's the boundary of field of vision. So beyond that, you can't see because it's not in your field of vision. And when you're actually presenting, the audience may have some trouble with this, just because it's not really a common activity, and they might not have heard your instructions the first time. So go around and maybe, interact with them a little bit. Try and help them out, help them understand the field of vision. And when you're going around, helping them, also answer any questions that they might have, just because it's more personal and they might feel more comfortable asking you questions when you're amongst them. And then if you have a really good question, take it back up to the front and be like, I got a really good question, and sort of answer it in case anyone else was wondering. So with all of that in mind, it is very important to remember that we need to get eye examinations done every year according to the National Eye Institute. And this is because glaucoma is very difficult to recognize in the early stages just without an eye exam. Like from the optical illusions before, what we were saying is sometimes the mind and the eye can be tricked. And in the case of glaucoma, sometimes often the mind and the eye are tricked into thinking that their field of vision is still whole and complete, when in reality it's sort of slowly shrinking due to glaucoma. And effects on, any vision that is lost due to glaucoma is actually irreversible, but because it is treatable, glaucoma shouldn't be as much of an issue as it is. The reason it is because it's just not tested for enough. So it's very important to go get tested for it every year. So what we have here is, in a way, it's another optical illusion. It kind of demonstrates how glaucoma works and how it happens, and the way that vision dims from the outside in. So if you look just at the pink lotus, watch it carefully, and gradually it will start to seem as if, see, now we can tell. Now it is very obvious that vision is being lost. But in the very beginning, it was very difficult to tell. I don't even know when the activity actually started. So this is kind of just an example of how glaucoma is difficult to diagnose in the very beginning, in its early stages, and it's very difficult to self-diagnose. So it's important to go get tested for it every year, just so that we can catch it before